Hey you guys, it's Nurse Desi. I'm back with another video. If you guys are new to my channel, let me introduce myself. So my name is Destiny. I'm a 22-year-old registered nurse. If you're new to my channel, I graduated from nursing school in December of 2023. And in January, I passed my NCLEX and I'm starting my nurse career in the ICU, in the medical surgical ICU to be specific. And I've just started my ICU nurse orientation, or like my it's called like a residency program. So I started my residency program in February, and I'm currently in my second week of orientation. So this week I'm going to be bringing y'all along of how my second week of orientation is going, and I want to update you guys too on what I have done so far since my last vlog, because I did vlog my first shift as a nurse, but I ended the vlog there. So I've done quite a lot since then. So I'm going to update you guys on how my first week as ICU nurse has been and what this next week is going to entail. So if you like this video, if y'all want to see like day in the life of a nurse, a new grad nurse, how it is being in like this residency program, keep watching. Okay, you guys, so today is March 7th and it is Thursday. So I'm starting this vlog off today because I have a pretty busy week starting next week. Next week will be considered my second week of my new grad orientation. And it's gonna start picking up, like it's a lot going on in this whole month. So first I wanna tell y'all how my last week went. So my last vlog, I did vlog my first week as a nurse. And really that was like orientation week. So my job considered that like week 0, since we really were only doing orientation in one shift. So my last week was actually like my first like full week of being on the unit and everything like that. So my second shift as a nurse, y'all, it was so busy. It was on Sunday and we actually got tripled. And I am in the ICU. So if y'all don't know, the patient to nurse like ratio is typically 2 to 1, but we were very short staffed. So me and my nurse got tripled, but luckily it's 2 nurses. So obviously it's a little bit easier to take care of 3 patients. So I was able to get my first patient that day. And y'all, I really like, I went into it because I wasn't expecting to get a patient on my like second shift. I was pretty much just doing the full care for that patient the whole day. And y'all, it went great. Like, I'm so glad I did not overthink it, because it went great. Like, I passed all the meds that day. I was able to get my access to the Pyxis, so now I can pass meds. And pretty much like my nurse went with me for the first med pass to just show me how to like scan the meds in, and how to like look at each medication and Epic, and just make sure that like I know how to see like how to administer the medications and everything like that. But after that, I had the patient the whole day. So I was just like getting the patient up, going to the bathroom, pretty much answering all my call lights, charted the full assessment. Y'all know in the ICU, we chart a lot. So I had to do 3 complex assessments. Every 4 hours, I have to do a full complex assessment. And my nurse actually taught me some like pretty easy ways of charting. So now I feel like I got my charting down. And also, whereas like managing like very high risk drips, the patient that I had pulmonary hypertension, and the patient was on a medication that has a half-life of like 3 to 5 minutes, and it was going through a CAT pump. So if y'all don't know, like if that medication was to stop for any reason, it could be very, very detrimental to the patient. So I had to learn how to work the CAT pump. And since it's such a short half-life, if something was to happen to the pump, I have to have a backup pump to be able to troubleshoot it like very fast. So I learned how to troubleshoot the pump. And then my patient actually was able to get transferred to the floor. So I called the handoff to the floor nurse for the first time and did a full transfer. So that was a really, really good day. And then the other patients that we had, I was still like helping my nurse with her patients too. But well, I mean, it's really all of our patients, but I was doing everything for those patients and then also taking care of my patient. But yeah, like that shift went amazing, and I really started to feel like an ICU nurse. Like it started to really set in, like I'm a nurse And I actually haven't been having like too much pre-shift anxiety because I think I just know because I have a really good preceptor and I know I'm not alone. But I've been feeling really great. Like, she's easy to ask questions. She's so smart. And I've been having like a great experience. And then on that shift also, we did have a code, but not with our patient. It was another nurse patient. But of course, in ICU, if there's a code, everyone's going to be in the room. So I was in the room. My nurse who was precepting me was the recorder during the code. And then I stood in the compression line. So I was about to give compressions, but the doctor just called time of death after like a couple rounds. So unfortunately, the patient did pass away, but I was able to see like how a code would be ran, and even during the code, like, I love how my preceptor was like taking me aside and showing me like, see, like, everyone has a role. Like, there's a compression nurse, it's a medication nurse, it's a recorder, it's a nurse that's managing the drips. Like, it's always something going on. So even though a code can seem so like, it seems like there's a lot going on, it's so organized in ICU because like our patients unfortunately code a lot. So it's very organized. It's not like everybody's just like running around and stuff like that. So it was really, really good. I had a really good shift that night. And then after that, the whole rest of the week I did classes. So the next day I did like a class where it was introducing us to our residency program. And then I did a central line class. So the central line class, they just went over all the different types of central lines, how to manage them, how to prevent collapses and infections and everything like that. And then like which lines we can pull and which lines we can't. So that was a good class. And then the very next day I had my epic class. So now I'm officially, I done my epic class. So now I can officially chart on my own. And yeah, so it's been going really, really great. So after the epic class, I had 2 days off. Yesterday I had off, and then today I have off. So today I plan on going to the gym, y'all, because I have been in my gym era. Like, I got my gym clothes on, I'm ready. So I'm about to go to the gym, and then tomorrow I work, and then I'm off on Saturday, and then I work again on Sunday. And then Monday and Tuesday I have class. No, actually Monday I have class. Tuesday I work, Wednesday I'm off, and then Thursday I work again. So this is gonna be a very busy week period. But I want to show y'all how it is being in residency, being a new grad nurse. Like, you pretty much feel like you're in nursing school all over again. You're gonna be very busy. So I want to bring y'all along so y'all can see how busy it's gonna be. And yeah, so let's go to the gym. Okay, y'all, so I'm on the way to the gym, but I wanted to come back and talk to y'all because I wanted to let y'all know like how I'm doing mentally. Like, have I been feeling confident? Have I been feeling nervous? What is life like after being in nursing school for so long? And I wanted to let y'all know, all my girlies in nursing school are about to graduate, like, life gets better, y'all. Like, I can tell y'all that I have been mentally feeling so much better. And I'm not even talking about like the money after nursing school or anything like that. I'm talking about like your actual mental health. Like, I have been going to the gym. I have been doing so much like self-care, self-love. Like, I have been just able to finally like pour into myself and not be feeling like guilty for not doing work and not studying. Like, even with all the modules we have to do like at the beginning of starting a job, like, that still does not feel anything compared to how stressed you feel in nursing school. And I've been feeling so good. Like, these past 2 days, like, instead of doing any work stuff, I just said I'm not doing anything involving work. I'm just strictly going to be focusing on myself and pouring into myself because I know I have a very busy week coming up, and I don't want to be doing all this work at home. Like, I've already caught up on a good amount of modules, and I'm not doing no more this week. So I've just been feeling so good, like spending time with friends, family, just really enjoy myself. So for all the girlies that's in nursing school, y'all, keep going. It's going to get better. Like, it's going to get better. And being able to be in a job that I love too is obviously making it much better, because if I didn't like my job, that would have probably made me feel very depressed. But I love my job, love my coworkers. I just love like my unit. So everything has been feeling much better. I haven't had any major stress, any like crazy feelings. Things have been going really good. So I just want to give y'all some motivation, because I know a lot of y'all are really graduating, about to pass your NCLEX, and are still like nervous about the thought of like, okay, after I get out of school, am I going to be like super stressed? And yes, I'm going to say being in probably any place as a nurse is stressful. So I'm not going to make it seem like it's no stress at all. but being able to like leave work and leave work at work and actually enjoy your outside life feels very good. Like, I've been just really pouring into myself. I told y'all I'm trying to get active in this gym, and I've been going to the gym almost every day of my off day. I went yesterday, I'm going today, and then I plan on going Saturday. So I'm shooting for 3 days a week. I will go more, but the other days I'm in class and at work, and I have not mastered being able to like work a 12-hour shift and go to the gym. Like, I can't do it. So for now, I'm just going on my off days, and I've just been loving it, y'all. Like, life has been great. So that is the update on how I've been doing. And yeah, so I'm gonna try to get some footage of y'all in the gym. Yeah, I have been lifting in the gym, and I've been doing a lot of cardio because I'm trying to lose weight, but I'm also trying to like make sure my body stays in a good shape. So I have been lifting, and I like going to the gym. Like, the gym is such a good feeling, y'all. I love it. So hopefully my body starts transforming over the next couple months. My birthday is in June, and I plan on taking my first trip, so I need to get right. So yeah, I will talk to y'all later. See, my days are cold without you, but I'm hurting while I'm with you. And though my heart can't take no more, I keep on running back to you. See, my days are cold without you, but I'm hurting while I'm with you. And though my heart can't take no more. Good morning, y'all. So today is March 8th, and I'm dressed and ready for my shift today. Yeah, I'm so excited, y'all. I've been getting up doing a little bit of makeup because I feel like day shift, like, you want to look very presentable. And then I noticed like I do better when I feel better and look better. So that's why I've been doing a little bit of makeup. So look nice and pretty. I'm going to go make my coffee. And I want to stop by like the gas station and get me a Celsius and a little snack because I forgot to stop later. But I did cook last night, so I cooked like chicken and rice, so I brought that for my lunch. But I just need like some snacks because sometimes I don't eat till later on in day shift. Like, I'm used to eating around like 1 a.m. on night shift, but sometimes on day shift I don't eat till like 2 or 3 p.m. So to hold me over, I like to get a little snack. So I'm gonna stop, get a Celsius and a snack, and then I'm gonna get me some breakfast. And yeah, so y'all know I'm helping for a very critical patient because I feel like when I'm on orientation, I want to see the most critical type of situation so that when I'm by myself, I've already like seen this. Like, I don't want to go through orientation and then like only get like stable patients, and the next thing you know, I'm off by myself, and then I get some like crazy assignment and I'm like running around, don't know what to do. So that's what I want to do. And I'm hoping I'm able to like practice a lot of skills because I do have a little sign-off sheet that like based off of what skills I do, I'll get signed off on it. So like it's a good amount of stuff that I got to do before I'm like fully off of orientation. So I want to start getting some things checked off. So yeah, so I will let y'all know how this day goes, and I'll talk to y'all later. Hey y'all, so I am back at home. I know y'all thinking like, did I even work? Yes, y'all, I'm off of work. So today went great. Pretty much I had 2 stable patients. So our census right now have been really low at my job. We have almost 40 beds in our ICU, and it's split into 2 levels. And we only had about like 20 patients. So it was really, really chill. I had 2 stable patients. One of my patients was on the vent, but they were stable. And then my other patient, I was actually able to get them transfer out. So the patient that I had that was actually my patient, I was able to take a patient by myself. So I fully charted all shift. But the patient that I had was being transferred to an LTAC. So I was super happy for them. I was able to call the handoff to the LTAC nurse, and then the patient was transferred at the end of my shift. So it was really, really good. I got to do the full care throughout the day. The patient been on the unit for a long time, so they were ready to leave the hospital. So I'm really happy I got to do a transfer that was like outside of our hospital, like an outside transfer, so that you can see the process. It's a little bit differently. I had to get the patient like ready for transport, and I had to call EMS to get the patient set up to be picked up to be taken to their new facility. So it was a lot. And what else did I do? I felt like I was really, really getting into the flow of things. Like my charting, my time management is getting better. Like I can definitely say I'm still like very slow at giving meds. I can definitely say like meds is typically what takes me the longest, because y'all know ICU patients have a lot of meds on top of like PO meds, because patient I had a peg tube, so crushing all the meds, giving the meds, and then they have IV meds, IV push meds, and then like if the patient is nauseous, I'm giving like PRNs, pain meds, morphine. So like getting my flow of like giving meds, and then on top of it, both my patients were on contact, so I'm like gowning up, I'm like sweating, y'all. I was sweating so hard today. I was so like, I was hot, y'all. If y'all ever been in them isolation gowns for more than a couple minutes, you're gonna be sweating like a dog. So that was one thing that I can admit, but I would rather go slow and take my time when giving meds than make a mistake. So like I even told my preceptor, I was like, I know I'm going super slow, but like she was like, girl, don't worry about it, because like the patients were both stable. She was like, there's no reason to be in a rush to do anything. Like I'm giving the meds on time, I'm not late, so there's no sense in me being like. But I'm sure that like y'all have seen a lot of nurses, especially nurses that have been there for a long time, they move so fast. Like they can give meds so quick, they can crush up all the meds and just flush the tube and do everything, and you're like, how are you doing it so quick? But me, y'all, I'm like double checking and verifying. I'm looking at it like 100 times. Like before I pull up the drug, I'm like, is this the right drug? Like I gotta make sure. And like even though there's so many checks, like of course you gotta scan the patient first, scan the meds. Like it's gonna tell you if there's something going wrong, but like you still have to like pay attention, because there's like special instructions for certain drugs. Like I actually had to give a couple hazardous drugs that I've never given before, so it's a lot of special instructions. Like you got a double glove, mask, gown up. Like if the drug gets on you, it can be like hazardous, toxic to your skin. So it's just like a lot of stuff you got to pay attention to. So yeah, I feel like I'm really doing good, and I'm glad that my nurse has like a break in between her days, like because she typically does like one on, one off, and I'm kind of glad about that, because like we're able to see different patients each time that we come to work, because typically like if you have a day off, you usually don't get that same patient back. But sometimes you can, but you usually don't. And also it just gives me a break, because I was a little tired today, because I was ripping and running, standing in that gown all day. I'm tired. So it was really good though. Like my nurse said I'm doing great. Like I feel like I'm doing like really well. Like I'm finally starting to know, because like charting was one thing. Like y'all know charting takes so long, but now like I have a sheet that I can check like all my charting, because you know like our complex assessments are Q4, IV assessments Q4, and then the patients have like trialysis, dialysis, port, permacath, IJs, and then they got PIC lines. So all the IVs and access have to be charted Q4. Any tubes, lines, or anything like that, Q4. And then it's like certain things is Q shift, like your care plan and stuff. So I'm trying to like finally get my flow. I have a sheet that like tells me like what I've charted and what I haven't charted, and then y'all verifying the vitals and verifying your infusions every hour. It's just so much things. So now that I'm starting to like do it a lot, I'm starting to know like what I gotta do to have all my charting done. And then of course my preceptor, she still looks over my charting, but so far like the charting has been looking good. Like she says I've been doing good on charting. It's only like a couple things that she has to like kind of correct me on, but other than that I feel like I'm really doing good. So week 2 is going good. I have tomorrow off, so I'm probably not gonna do anything. I may go to the gym or just relax, and then Sunday I'm back for my next shift. So I'll come back to y'all either tomorrow or Sunday. Bye.
Only been a few hours, but it felt like days. Only been days, but it felt like months. Been gone for a year, only know like once. Life moves fast when you do what you want. I guess I'm doing what I want. Hope you know.
Good morning, y'all. So today is March 10th. I didn't come back on the vlog yesterday because I was off, but all I did is go to the gym, and then I just spent some time with family. So I was just chilling all day. So I did get a couple clips of me at the gym, and then I came back home and I made dinner. So I actually made some spaghetti and I meal prepped that to bring with me to eat today. So that's gonna be my lunch. And yeah, so I'm dressed and ready for work. I got my ICU nurse shirt on, and I just got my figs. Today's Sunday, so it's usually very chill at my job on Sundays because there's no rounds, no doctors. Well, it's doctors, but not as many doctors. So I'm chilling today. So I'm hoping that we get a really critical patient, because I want that like real ICU experience so that I can know what's going on. So I'm doing my hair right now. I'm just doing my edges so that, and then I don't even know what I'm gonna do to my hair. I may like twist it up or something and then like wear it to the back. Because I don't be wanting all this hair in my face. So yeah, I may do that. Either this or I'll just, I think I'm gonna do it like this. Yep, this is my go-to style because it's simple. But yeah, so I gotta make my coffee because I'm tired, but I did get some good sleep last night, so that's a win. Let me finish doing my edges. But yeah, like I'm so glad my orientation has been going great. Like I love my preceptor. Like me and her get along so well. And that was really just my biggest fear, is that I was going to get somebody that I don't vibe with, or get somebody that like doesn't give me that independence. And my preceptor, she definitely gives me that independence. Like I don't feel like I'm being baby. Like I feel like I have fully my own patient. Like the only thing that she'll do is like go over my charting, and then if I need like help on something, she'll just come in and like help me or teach me something if I have a question. And even with her other like patients, or even with like other people's patients, she'll still like take me in and show me, because there was another nurse that was putting up a PCA pump, and she was just like, come here, like let's go learn how to set up this PCA. So I just love that she's just always offering to help. So I'm having a great experience, and I know for a fact that it's going to stay pretty good. And I'm glad that I'm consistently with her, because sometimes, like I told you guys, I don't mind getting switched around to different preceptors, but when I get a preceptor that I really, really like, I do want to stay with them. So since I really like her, I would love to stay with her my whole orientation. So yeah, I'll keep y'all updated on how this shift goes. I'm probably gonna take y'all down and make my coffee with me and everything. So I'll see y'all. All right, y'all, so I got my lunch box, coffee cup, Stanley. So let me get my lunch. I got my spaghetti, y'all, and I got some garlic bread. I have to start eating healthy, like I have to. But that spaghetti was so good last night. I'm like, yeah, I really wanted to bring that to work. Got my Celsius. And y'all, I have been needing my Celsius on day shift, because I'm just, like, as soon as it gets past lunch, I get so tired. Got some chips. And that's it, because I'm gonna stop and get breakfast, so I don't need to pack breakfast, but I do need to get my coffee. Okay, y'all, got my coffee. Yeah, I be going through this coffee like crazy, because I drink this coffee every single day. But I got some more creamer, because I ran out of creamer the other day. And this is sugar-free, so that is good. All right, that should be enough. Do a little taste test, let's see. Okay, good. Now let's get some water. Hey, you guys. So I am out of my shift, and y'all, it's daylight saving time, so it's bright leaving work, and that feels so good. It's 7:20. Yeah, I had such a fun shift. Like, this was a fun Sunday shift. So I got to work, and first, like, at my job, the census is low, so like we only have like 19 patients, and our ICU is almost a 40-bed ICU. So we have 2 levels to our ICU. So we actually closed down our top level, and we're only on our bottom level because there's no patients. So it's a very like chill day just because there's hardly no patients on the unit. But I came in, and my main preceptor, she actually called out sick today, so I was put with a new preceptor for today. But it's actually somebody that I already know, and she's one of my favorite nurses. She used to work night shift, but she switched to day shift, so they put me with her today. And y'all, we had a great shift. Like, I got my own patient, and both our patients were both like really like chill patients. I'm probably gonna start asking for some more sicker patients, but since it's the beginning, I do feel like I'm starting to get my flow, like just being able to like chart and do my assessment. And it's good to start on patients that are not like super critically like crashing type patients. So the patient that I had, main goal was just pain control, and so I was just managing her pain, and I felt good because I found a regimen that was helping her with her pain, and I was actually able to get her transfer out. And funny story, y'all, so I'm calling the floor to give the report to the floor nurse, and I'm on the phone, I'm giving her like the report, and then at the end of the call, like the girl was like, "Hey, like, did I go to school with you? Are you Destiny?" And I was like, wait, I said, "What's your name?" And then she was like, "Oh, I'm so-and-so." And I was like, oh my gosh, y'all, why me and her went to school together? We were in the same cohort, and she's in orientation on the floor, and I'm in orientation in ICU. And it was just so funny because I was like, I didn't even know that she was coming to my hospital. So we were just cracking up, and I was like, "Hey, girl." And I always joke around with like people that are coming to my job. I'm like, I'm pretty sure I'll transfer a patient to you one day. But it was just so funny how we were on the phone with each other. Didn't even know that me and her went to school together. I actually had a skills lab with her, and she's so cool. So I actually told my patient, I was like, "You're in great hands," because I went to school with her, so she's gonna take good care of you. So it was super cute. So transfer my patient out. After that, I was down to 1 patient, and my other patient was like a post-op, and they were pretty sick, so I actually had to give a blood transfusion. But this is like my 3rd blood transfusion so far since I've been on orientation, and I'm finally starting to get the flow of giving blood and like assessing for a transfusion reaction and everything, because in the ICU it's kind of different, because sometimes like your patients may not be able to tell you like, oh, something's going wrong, because you know, like in school they tell us like if your patient ever has like flank pain or back pain or anything starts hurting or shortness of breath, like stop the infusion. But when you're in the ICU, a lot of the times the patients can't tell you that, so you have to be a little bit more observant. You got to be taking temperature, checking vitals, and of course they're already on the monitor, but you got to be checking heart rate, blood pressure, breath sounds. Like, it's a lot more that goes into blood transfusion. So I feel like I have my blood transfusions down. And then, like, since there really wasn't hardly any patients on the unit, I was helping some other nurses with their patients and helping with admissions and stuff. So it was a great shift. Like, I felt like it was a fun Sunday shift. I learned a lot, and it did feel good being with another preceptor, just getting a new perspective and just seeing what other preceptors do versus what others don't. So it was a good day, y'all. So I do have to be back to class tomorrow, y'all. So the class is at 1 p.m., so I do get to like sleep in a little bit. So I'll come to y'all tomorrow for my class. It's a central line class, and it's actually the skills portion. So I have to do 2 checkoffs on a central line dressing, and it's pretty serious because y'all know like hospitals don't play about collapses, infections. Like, they want to make sure that you are prepared. So I'm gonna make sure I practice and get this skills check off on the first time. So I will talk to y'all later. Bye. Good morning, you guys. So today is March 11th, and y'all, it took everything in me to get up this morning. So I told y'all I do have a central line class today. So I have to get checked off on doing central line dressings, and it's very serious. I got to do it twice, and if I don't get checked off, I got to stay longer. So I want to make sure that I get checked off the first time. But it's from 1 to 4, so thankfully I don't have to be there too early. But y'all know I worked yesterday and I am like exhausted. Like, I'm so tired. I don't know why. I thought being on day shift, like, you're not going to be as tired. But y'all, I still feel like I worked night shift. I feel so tired. And I think it was too because yesterday was daylight saving, so I lost an hour of sleep. And I didn't even know it was daylight saving until I was on the way to work. So that could be a reason why I'm super tired. But I'm like exhausted. And worst part about being in a residency program is having to work your 312 shifts and then having to still be at the hospital for classes like two times a week. It's pretty much like you feel like you're at work every single day, basically. So that's the hardest part. The classes are very beneficial, though. It makes a lot of sense when you're actually in practice because you don't want to be, you know, like making mistakes with people's central lines. And, you know, that's a major source of infection. A lot of patients get septic. So it's a very serious thing. But I'd be so tired, y'all. I'm so tired. So, and then on top of it, tomorrow I have to work another 12-hour shift. So this is reality of what it is like being in a residency program. But I'm grateful. I'm thankful that I'm here. But I went ahead and did my hair in this like updo ponytail because I'm going to be doing central line and sterile field and stuff. And I don't want my hair all in the way. So I'm going to wear my hair like this. And yeah, so I'll talk to y'all on the way there. I'm going to grab some food and then I'll be headed to the hospital. So I'll let y'all know how it goes. Hey y'all, so I'm already out of my central line check off, and y'all, that was so easy. It took me like less than an hour because we had to get checked off twice, and I finished it very fast. They signed me off and I was able to go. So check off was actually pretty easy. It's kind of like nursing school, but they're just making sure you don't break sterile field and you know how to do a central line dressing. So that was easy. Now I gotta go home and do some more work. So I will talk to y'all later. Good morning, you guys. Today is March 12th and it is Tuesday. So I'm up and ready for my 12-hour shift. Yeah, I feel good today. I'm praying for a good day today. I told you last shift my preceptor was sick. She called out, so I hope she's here today. If not, I'm gonna be put with someone else, but I'm okay with that. I think I told you guys like a while ago, I kind of like having a couple different preceptors because you get to see different perspectives and just see like how everyone does their flow, and then you kind of get to like grab bits and pieces from everyone and then kind of make it into your own routine. So I don't mind having a couple different preceptors. But yeah, so hopefully today goes well. I do want a critical patient because I've been getting a lot of stable patients and I feel like comfortable with my stable patients, but I really want a critical patient to kind of test my skills, test my critical thinking. So I'm hoping we get a sick patient. But I told y'all my census have been really low at my job. We haven't been getting too many like really sick ones. It's only been a couple. The ones we've been getting is kind of like fast turnover rate. Like they come and then they get better really quickly and then they go to the floor. So that's typically been what's been going on. And I think like they think it's because spring break, and if you guys are in ICU, it's kind of like waves. Like sometimes it'll be no patients in ICU, and then sometimes everybody comes in there like all super sick. So it comes in waves. So I'm okay with whatever I get, but I will update you guys on how today goes. And I'm gonna go get some breakfast, make my coffee, and get ready to leave. So I'll talk to y'all later. Hey y'all, so I'm at work, y'all. Today has been crazy, super busy, but a great day. I had a really sick patient today and I feel like I handled it great. Like I did a great job. So right now I'm about to straight cath my patient, and I just did a Foley on my other patient, so I got to straight cath my other patient because I bladder scanned the patient, and the patient's bladder was over 400, so we straight cath if their bladder is over 400. And then the other patient got a Foley because he has chronic like urinary retention, so he just went straight to Foley. But our hospital has like an algorithm to prevent Foley infections and everything like that, so we straight cath 3 times, and then if it's over 400 3 times, that's when they get a Foley. So about to straight cath my patient, and it's like about to be 6 o'clock. I'm about to wrap up. I finished all my charting. I have to go get my drips because my patient is intubated, sedated. They're on propofol, fentanyl, Versed, everything. So I got to make sure all my drips are good. I'm going to go grab some backup drips because good nurses, you want to always make sure that your night shift has plenty of drips and everything is not going to run dry, especially like pressors or anything like that. Like, you definitely don't want them going dry. But I gotta get backup sedation, and yeah, so I just wrap up my day. My preceptor actually was not here again, but I got a preceptor to be with today, and today's actually like her last day, but she's so freaking sweet and she's been the best. So hands down, I've had great experiences with all my preceptors, and it's been great. And she's been giving me my independence. Like, she was like, girl, I can go home because you are doing everything. So I love that. I love getting good feedback. So I'll update y'all later. But y'all, it's Wednesday, March 13th, and it's the next day. I forgot to come back and tell y'all how my shift went last night, but I'll tell y'all a little bit later. But I'm on the way to the gym, y'all. I'm taking this fitness journey serious because the fact that I just did like 3 days straight going to work, and I'm back to work tomorrow, and I'm making it to the gym, like, I feel proud of myself. So y'all, wish me luck on this fitness journey. I feel like I'm making progress, and I feel like since I've been going to the gym, I've been feeling more energized at work. So I don't know if it's helping my stamina or my mood. I don't know, but I had a great shift yesterday. Even though like things got really busy towards the end of the shift, I felt like such a good nurse. Everybody was like hyping me up, and it's like everyone is so proud of my growth because since I started at my job as a PCT, it's like everyone knows that I've come such a long way. So it really does make me feel good, like when I'm finally like getting into my nurse era. Like, I'm really doing good, y'all. Like, I feel so good at my way that I'm taking care of my patients, how thorough I am, like my critical thinking skills. Like, I just feel so good. So but today is also going to be a fun day because I'm meeting up with my nurse bestie tonight. We're going to go get margaritas, and we're going to get some tacos at our little Mexican restaurant. And y'all, like, nurse days are essential. Like, make sure that you're spending time with your friends, especially in residency. If you guys are in a residency program, just know that you're going to feel very overwhelmed. It's a lot of days at work, but like, make sure that you're spending time with your friends and your family. And next week, I have something really fun planned with my sister, so I'll show y'all in that next week's vlog. But make sure that you're spending time and finding ways to, you know, incorporate the things that you like so that you're not becoming like overwhelmed with just working and all that. So that's why I'm making sure like I'm taking care of myself, going to the gym, spending time with friends, and yeah. So I'm gonna update y'all on my shift on the way to the gym, so I'll talk to y'all later. All right, so how my shift was yesterday, y'all. So I started off with just one patient, and thankfully it was a one-on-one because patient was very critical. Patient had a cardiac arrest like the day before, so patient of course was intubated, sedated, and it was a lot going on, y'all. Like, patient was on multiple drips, and when you're in the ICU, like, you have to manage your drips. Like, I think that was the one thing that was the hardest concept for me to understand, like managing my drips, knowing where all my lines can go, y'all, knowing which medications are compatible. That was the main thing that I had to pay attention to, because my patient only had a midline. In the beginning of the shift, my patient had a central line, but of course in the hospital they really don't want our patients to have central lines for too long if they really don't need them. So the doctors were saying to pull the central line out because the patient had a midline, right? So if y'all don't know what a midline is really just a long IV, but it's ultrasound guided. It's typically like in the upper arm, but it's not a central line because it's not going like to your heart. It's just a long IV. And those midlines are really not good, y'all, because you cannot infuse incompatible meds like you can infuse on a central line, because on a central line it's going to your like subclavian vein or whatever. So since it's such a high blood flow, you can infuse incompatible meds through different injection ports, but you can't do that on a midline because they're all going into the same vein, and the vein is like not that big. So at first I didn't know that. So when I got there, of course, like the patient had like a lot of like propofol going, fentanyl going, Versed, and then they also need antibiotics, their normal saline fluid, like a whole bunch of meds going. So those were compatible. So I was like, okay, everything's fine. So we pulled the central line out because I'm like, okay, like the patient is not on vasopressors or anything, so there's no reason that we need this central line. Well, I thought. So later on in the shift, the patient had an antibiotic that was due, and since I knew, okay, the antibiotic was like infusing over a couple hours, and at first I was just gonna scan the antibiotic and just give it, right? But this is why I be saying, y'all, make sure as a new grad that you are like stopping, thinking, and verifying before you do anything. Like, don't just assume that you can just start hanging up stuff or giving meds, like, even though you think, okay, it's just antibiotic, like this can't be harmful. Make sure that you're stopping and verifying. So something told me like, okay, let me make sure that this antibiotic is compatible with all my meds that I have going. And thank God I did that, y'all, because I looked on our MAR, because our MAR can take us to a site that can tell us if these meds are compatible. I inserted all the meds, and they said that med was not compatible with my propofol. So I could not stop my propofol in order to give this med because my patient was having active seizures. So I was like, okay, what can I do? So first thing I thought of is like, okay, let me call the pharmacy, because the pharmacist can tell me more of a in-depth answer on if these meds can go together. So I called the pharmacist, verifying that I cannot give these meds together. So the pharmacist was like, no, like those meds cannot be ran together whatsoever. So I was like, okay. So the issue now is that I don't have any other access because we've already pulled my patient's central line out. So I'm just like, okay, what are we gonna do? So basically, I had to call IV team to see if they can come and insert an IV in my patient, and I did try to see and look and see if I can get an IV on the patient, and the patient was so fluid overloaded, and it was just no possible way that I could have inserted an IV anywhere on him. So they looked, the IV team said they couldn't insert an IV because they can't find one. So basically I was not able to give the med that I needed to give. But I was happier that I was able to actually recognize that these meds were not compatible and not just giving it and possibly harming my patient. And my preceptor was like, that was such a good catch, because some people, they would have just hung up that med and didn't even pay attention to see if they were compatible or not, because some people are really not thinking that in depth. But so everybody was like kind of cheering me on, because that's like a near miss. Like a lot of people would not have paid attention to that. So just catching small things like that could have, saved my patient or just prevent any harm from happening to my patient. And like, it's other ways that we can, switch the antibiotic in order for the patient to get their antibiotic, or have to insert another central line or insert another access line in order to give the patient that meds that they need. But we don't want to just be infusing things that are not compatible and harming the patient. So I felt really good, and that really like taught me a valuable lesson to just like making sure that I am thinking before I'm giving stuff. And like, that's not the only time that I did that. Like, even on my other patient I had on Sunday, like just simple stuff, like the patient could have meds due, and I know us as nurses will like see a task and we want to just get things off our brain, complete our tasks, and just get things done. But you gotta like pay attention and stop and think before you give stuff, because my patient was in pain and my patient's blood pressure was very low. So of course I want to treat my patient's pain, and then the patient had pain medicine that was scheduled in PRN. So I had already given the patient a PRN med, but then the patient's pressure got lower, and I was like, okay, I don't want to give her nothing else that can like bottom her pressure out. And she had a med that was due that was going to help for pain, but I could not just give that med on top of the PRN that I already gave, because that could really bottom this pressure out, like bottom her pressure out. And then now I got to start some pressor medication to get her pressure back up, and next thing you know, she's in the ICU even longer. So that's why I had to like stop and think and be like, actually I'm gonna hold that med and wait to see if her pressure goes up, and then if it does go up, then I'll go ahead and give her the med. So it just takes a lot of just like stopping and thinking and knowing what's going on with your patient, because you can't just be giving stuff just to give it and not paying attention to what you're really giving. So that's my advice as all my new grads coming in there. Like, make sure that you're stopping and thinking. Don't just get into that tasky mindset, especially if you're in any critical care setting. Like, it may be a little different when you're on the floor. Those patients may be a little bit more stable, so you may be able to kind of get away with certain things. But like in ICU, these patients are all critical. I can't be taking no chances with nobody's life. So make sure that you're stopping, thinking, verifying, and taking your time and not being in a rush, and don't be in that tasky mindset. So yeah, that's my lesson. And like, I want to make sure I'm bringing lessons to y'all after each of my shifts, because being on orientation is already scary and nerve-wracking, and I want y'all to feel like comfortable. Like, even for like all my nursing students that are like nervous to start working, I want to give y'all tips so that when y'all start, y'all feel like successful and not feeling overwhelmed, because a lot of new grads get to the ICU and don't make it with like over a year, because they're just like, I can't do this anymore. So I definitely want to just teach y'all ways of just like taking stress off of yourself, because if you're doing your due diligence as a nurse, you won't feel like, you know, that heavy load or feeling like you did something wrong if you're making sure that you're crossing all your T's and dotting your I's, basically. So I'm about to head to the gym, so I'll talk to y'all later.
See, my days are cold without you, but I'm hurting while I'm near you. And though my heart can't take no more, I keep on going back to you. See, my days are cold without you, but I'm hurting while I'm near you. And though my heart can't take no more, I keep on going back to you. Baby, I don't know why you're treating me so bad. You said you love me, never for me, and I was all you had.
That's how you put it. It is March 14th and I am dressed and ready for work. I did not come back to y'all last night because y'all, me and my bestie, we had a time, y'all. And that might be the first and last time I go out the day before I work, because I'm so tired, I'm exhausted. But today's my last day of work this week. I do have the whole weekend off, so it should be a pretty fun weekend. I get paid this weekend. It's my first nurse check, so I'm going to do something for myself. I'm probably just going to relax, enjoy my weekend, and then I do have a class on Monday. So today is going to be the end of this vlog, y'all. I hope y'all enjoyed this video. Please like, comment, and subscribe, and I will see y'all in the next video. Bye.